Our goal really was to ensure that caregivers were part of the solution and that their goals and their needs were recognized, because if we didn't address that, then we really weren't going to be successful. The change that's occurred through the work that we've done under the stewardship of the Change Foundation and in partnership with the Sinai Health systems is that caregivers are now an important part of this conversation, and that any and all solutions must include them. And we need to ask them what their needs are in order for not only them, but the client to be successful.
We've also engaged with a large number of caregivers in the co-design event, and then also in our project evaluation process. It's been proven to be really helpful and invalidating for themselves to witness such a change in perspective, that the hospital and healthcare agencies are actually recognizing the needs of the caregivers and the needs of supporting people around the patient and the clients. What we heard from our caregivers in our co-design event was that the caregivers who were supporting individuals with serious illness in the community really needed respite services that's flexible.
It is more than just it being a nice environment for caregivers. It is more fundamentally bringing caregivers into the circle of care, training them, supporting them, and not dismissing them at the end of discharge, but handing off not just the patient at the end of hospitalization, but the caregiver into the community as well. So this type of partnership between an agency that's based in the community and a hospital is the way forward, and you're just going to see this more and more and more.
We also recognize how the needs of the caregivers and the needs of the patients are so entwined. We looked at factors such as caregivers' capacity, the care demands from the care recipient, the caregiver's own health issues, and then maybe other responsibilities in their life. So we looked at all that factors and incorporated in the development of a model to create a really integrated, the care unit focused model, and then implemented as a pilot project, which was co-delivered by WoodGreen Community Services and Sinai.
Part of the work that we've done with Sinai is to ensure that we followed patients, clients, and their caregivers from the hospital to the community, or from the community to the hospital. And by doing that, what we're showing individuals is that actually the system is integrated, and that our goals are your goals. It doesn't matter whether you're in the hospital or in the community. We understand that, and we're here to work with you. And I think that's the fundamental shift that we're seeing that will ensure sustainability. We're going to build it for our communities. We need to have our communities involved in the decision making.
You can be stunned when you sit in a caregiver room and understand what their priorities are, what they value, and what's needed. They're ideas you never come up with on your own. Partnership concept is crucial to the success of this and is our future.
We had incredible learnings so far from this pilot, and then we are still evaluating and analyzing our data. However, I'm really hoping that the findings and learnings from this pilot can inform the future support for caregivers, because what we're seeing is really important.
Clients want to stay in the community for as long as possible, and caregivers want to support them in that goal. And so that ultimately will be the impact of this work, is that people are able to live in the community with a high quality of life and ensure that the people that care for them are loved, respected, and their needs are also identified and met.